All right, so it's 12:15. We'll go ahead and get started with Gurgis, who's going to introduce our awesome speaker for this next session.
Good afternoon, everyone. I'm really glad everyone's able to join us today. So I'm just going to go ahead and give a little overview of the session and introduce our speaker. So first, on behalf of HMO, President of Impact Virginia, I'd just like to thank everyone for being here with us. This is day 2 of 4 of our symposium and our second session for the day. And I'm just really glad everyone's able to be here and make it with us. I also just want to start this session by thanking our donors for sponsoring this year's symposium. Our donors come as far away as Massachusetts and California, and we're able to offer the symposium free of charge because of their generosity. And so I just want to thank them for their support and give a special thanks to Dr. Peter Buckley, the Dean of VCU School of Medicine, for his continued support of our educational efforts. And then just going through a few of the logistics for the day. So this presentation for the session will be recorded. Throughout the session, please keep yourself on mute unless you have a question. And if you do have a question, either unmute yourself and ask, or write a question in the chat box. We'll be monitoring the chat and can ask on your behalf. And if you have a question that you'd like to ask anonymously, please send a chat to me and I'll ask without using your name. The content and discussion in this presentation will necessarily engage with issues of human trafficking, which can include sexual and physical abuse. Some of the content will be emotionally and intellectually challenging to engage with. Myself, the other moderators, the presenters, and everyone else who's speaking will do our best to make this virtual meeting a space where we can engage bravely, empathetically, and thoughtfully with difficult content throughout the session and the rest of the symposium. And as an icebreaker for this session, if you think you're the person living farthest away from where we are, so we're in Richmond, Virginia, we'd like to see if you'd write your location in the chat box just to see who's the farthest away. So far, the farthest we've gotten is Romania. And now for this session. So the title of this presentation is Fighting Child Sex Trafficking in Rural Communities, presented by Dr. Amie Ashcraft. Dr. Amie Ashcraft is a social psychologist who conducts research in topics related to women's sexual decisions and health, including contraception, preventative health screening, and sexual exploitation and trafficking. She's a research assistant professor and a director of research in the Department of Family Medicine at West Virginia University. She will be speaking with us today about the app she developed to train key personnel in rural areas to identify and report child sex trafficking. So thank you, Dr. Ashcraft, for being here today, here with us today, and I'd like to turn it over to you to get started.
Excellent, thank you. Let me get my screen going here. Okay, so thank you so much for having me. I wanted to tell you a little bit about the process that my team went through to create an app training and what we learned as a result and how we will be proceeding in the future. So I want to acknowledge my fabulous collaborators on this project. The lead principal investigator was actually Tamara Kuhn, and she works at an organization called Diffusion in California. And then Pamela Anderson, a senior research associate who also collaborated with us. And I was going to say that, we've had a really long time interest in this topic, and we actually applied for funding for this idea several years back. And at the time, we were not able to convince funders that it was actually happening in rural areas. That was their biggest critique. There's not enough of this happening in rural areas to warrant the funding for such a training. We found things to be quite different this time around. I think that there's been a lot more recognition and resources devoted to this area. And so interestingly, we applied to NIH for funding, and apparently both NIH and the CDC pulled our proposal to fund it and had a discussion over who was going to. In the end, the CDC had more money left over after they'd funded their other projects. And so I tell you that just because I want to highlight, if this is an area you're interested in working in, not necessarily developing an app, but in developing some sort of intervention or treatment or whatever that is for trafficking, I think the time is right. And then there are a lot of funding opportunities right now, and I would encourage you to consider that. Okay, so just to be sure we're on the same page, I know there's a lot of different terminology. We specifically used CSEX, so commercial sexual exploitation of children. And I know that, many of you will be familiar with lots of other terms: domestic minor sex trafficking, child sexual exploitation. Many things can be used to talk about this, but the point is that it does include trafficking, stripping, pornography, and sex tourism. And I really want to begin by framing this in a public health way, because this is a public health crisis, to be sure. Survivors are at high risk for a host of immediate and long-term outcomes in their lives. And to talk a little bit about why focus on rural areas, in case you're not convinced, there's a lot of stereotypes that sexual exploitation only happens in rural areas. There's a lot of, coverage on the news about wealthy men with private islands and jets. And, there's movies where Liam Neeson goes and rescues his daughter in another country. There's a lot of kind of stylized versions of what trafficking looks like. And that's not necessarily what it looks like in rural areas. In rural areas, there are high rates of poverty, high rates of unemployment, lots of geographic isolation. And these areas, particularly in Appalachia, have been hit the hardest by the opioid epidemic. And many of you will know that one of the biggest motivators for someone trafficking someone else is to earn money for, illicit substances. And a little bit further, we know that the majority of familial trafficking seems to be happening in rural areas. And that's something to be aware of as well. We see that this kind of exploitation is often misclassified as other things. It's mistaken for sexual abuse, sexual assault, abandonment. And we also know that there's a lot fewer specialized resources and training opportunities in these areas. Many of you that work in this area will probably know that rural areas have to get pretty creative in how they connect trafficking victims to services, because there aren't specific organizations that focus on that. So our goal when we first set out was to develop this training for service professionals tailored by profession and rural area to teach them how to identify and report sexual exploitation in youth. And, that was sort of a lofty, larger goal. The particular funding mechanism that we used for this, I don't know if you're familiar, but it's called an SBIR, and that's a Small Business Innovative Research Award. And it's kind of a unique funding mechanism in that there's a phase 1 and a phase 2. For phase 1, you develop a prototype of whatever it is that you're proposing, and you do some initial testing on that prototype. And, depending on what you find and how the testing goes, you could potentially be funded for phase 2, where you build the full project and, rigorously test it. So our project was actually 1 year long. And so we had to scale back our really large goal and focus on healthcare providers and school personnel. Our dream for the future is that ultimately a lot more types of service providers would be included in that. But for right now, that's where we needed to focus. And of course, those folks are some of the most likely people to come into contact with someone who's currently under the control of a trafficker. And so we get a lot of questions about, why develop an app? There's plenty of trainings that you can access online, through the internet, and there are. But a couple of things. First of all, I don't know how many of you have seen those trainings, but they tend not to be very engaging. But also, we really wanted something that was not just cost effective and easy to scale up, but it was really important to us that places that didn't have a lot of cell service or internet connectivity, such as large portions of West Virginia, we wanted those folks to still be able to access this resource. And although it's true, you have to have internet access to download or to update an app, actual day-to-day use can be done without that connectivity. So we ended up testing a number of different logos, titles, project names, and the one that won was called Freed, focusing on rural exploitation education. So this is our chosen logo for the time being. I don't know that it will stay the same throughout phase 2, but that remains to be seen. Okay, so we did a little bit of formative research before we even started, building the content. We started out, we really wanted to interview a wide range of service providers. And this was to inform, the current content, but also to help us kind of think ahead to what kinds of content we might like in the future. And so, we talked to folks from, healthcare, schools, first responders, social service providers, really ran the whole gamut. And we really tried to get folks from different kinds of rural areas. Appalachia was something that was easy for us to focus on because of my location, but we really tried to spread out across the nation and to look at different types of rural areas and to pull in folks with perspectives from those. And we did have a number of expert consultants working with us. Those included survivors and trainers working with the West Virginia Human Trafficking Task Force. And so, not terribly surprisingly, our interviews kind of revealed that most people didn't think that trafficking was happening in their area. Even ones that had had some training on it, knew enough about it to be able to talk about it, but didn't really fully appreciate how it was playing out in rural areas and how much it could potentially be happening around them. Access to previous training had varied, widely. And everyone seemed to want more specific information on identification and on how to report. Those that were already mandated reporters, knew some about that, but many did not. And so the content development, we ended up, two of us wrote the actual course modules. We worked with our consultants to review the content, to review the language, and we created really detailed storyboards for what every single frame of the training would look like. So, what was the narrator saying? What was happening on screen? What images were being shown? And, we heard a lot of anecdotes and stories and got a lot of resources from the folks that we interviewed. And those things really became the material for kind of case studies, mini cases, interactive scenarios, role playing, those kinds of things that were in our training were based on those real life examples that we were hearing from the folks that we talked to. And, we continued to consult with our experts throughout the process. And so with the prototype, we ended up developing 2 prototype course modules. One that really focused on the characteristics and dynamics of CSEC, and then the other one more specifically on the clinical presentation of it. And as I mentioned, it was really important to us that this training be engaging. We didn't want it to be something that people kind of did to check off their list and then put it out of their mind. We really wanted them to think about it and to think about what these things might look like in their area specifically. So we tried to bring in a lot of kind of interactive features. So there were learning checks where we would ask people to, match the term to the example that it was talking about. We had a whole section on myth or fact, looking at what they had learned about what's true and what's not true about trafficking and exploitation. There was a section that looked at different kinds of trafficking. So familial trafficking, pimp controlled trafficking, gang related. And, you matched up that type with the scenario, just anything that we could to have people interact with the content is what we tried to do. A little bit more on what the content looked like. We experimented with, I guess, a Tinder type interactivity where people could tap left if it was not trafficking or tap right if they thought it was trafficking. So we would present a little mini case and ask people to read that, and based on what they learned from the course to make a judgment, do you think this is likely to be trafficking or not? So there were a number of those. We had a section of the module where, a trafficker sent you direct messages, using kind of well-known recruitment scripts that traffickers might use. I want to get you out of this town. I have a friend with a modeling agency. You could be a model. You could have a better life. Let's get out of this town. And then you would interact with that person and see what the conversation was like. That was kind of fun. And we had a couple of survivors who shared their stories. And, it was really important to us, particularly with our survivors. We didn't want this to be like salacious detail that, that people kind of watched for, I don't know. Anyway, it was important to us that they tell their stories in terms of how this happened to them, how did they grow up in a small town and what their lives were like, and, how they got into this in the first place and why they stayed in it. And for the medical content specifically, we went to the WVU Simulation Learning Center, which is called STEPS, and we filmed scenes with an actual physician and 2 undergraduate students. One was a student playing the friend who came to a doctor's appointment with someone that had specific health concerns. And so, the user of the training was asked to role play this as if you're the doctor. You watch this scene unfold, and at various points along the way, the action will stop And it'll say, okay, what do you do next here? What's the right move? And based on what had happened, you decided, do I want to have the exam continue as it is? Do I want to ask the friend to step out? So we had several decision points along the way. Okay, and I just wanted to play just a couple of really brief clips from our survivors. Hopefully these will play smoothly for you. Wait a second. It's telling me it can't. There it is.
Can you make it louder, Amy?
I'll try.
Calming myself one evening and then the next day going to class.
That's better, thanks.
No, I paused it.
Walking over to a teacher's desk to hand her a paper so she would see it. So maybe she would ask me, what's going on with you, Angie? Is there something that's going on?
We lost audio again.
Is that helpful at all?
Can you play it again?
Let me try the second one and just see if that's any better or not. I'm turning it up as I can.
No, it's still pretty distant and scratchy.
All right, well, let me just tell you a little summary of what they're talking about. As I mentioned, it was important for us to tell their stories in a respectful way, but one that would teach folks, what their lives were like, what to look for, so that if they saw something similar in front of them, they might recognize it. And so Angie, in the first video clip, was really talking about trying to get her teacher's attention. She had been self-harming. She had, scars on her arm and, went to hand her teacher a paper, hoping that she would see her arm and hoping that she would ask, what's going on with you? But the teacher saw her arm, she made eye contact with it and looked away. And Angie said, I'm not trying to put this on teachers because they have a lot to deal with, but in that moment, I felt small and insignificant and unseen. And then Autumn, in the second video, she was talking a little bit about the experience of going to a healthcare provider during her time of being trafficked. And, she was obviously suffering from severe physical abuse, dehydration, STIs, she had a whole host of things. And no one ever asked her what was going on. It was sort of like, this is a junkie. She's just going to go back out into the street where she was, just treat her and get her out of here. And she said, I think most people can identify a human at their lowest point. And just to say, are you okay? Do you need help to be safe? Those can go a long way. She, realized that she might not have responded at the time, but that she needed someone to just ask. Okay, so sorry those videos didn't play. So another feature of our app, pardon me, was a resource center. And our hope was that, kind of in addition to telling people, this is what you would need to do to report. This is the kind of information you want to share when you report. We wanted to give people resources local to them that they could use. As we talked about, a lot of rural areas have to make do with what services they have. So a lot of times, the onus of helping folks who've been trafficked falls on, the domestic violence shelters, rape crisis centers, places like that. And so they have to get kind of creative with what they do. And so we put together, with using kind of the Google customizable map function, where we kind of categorized and listed resources, provided information about them, the website, who to call, the services they provided, as a way to help people link anyone to services that might need them locally. Okay, so once we had the prototype, we needed to do some usability testing to find out, like, do people find it easy to use? Do they know how to navigate? Does it make sense? Is it appealing? So we tested with middle and high school teachers, and we set up individual 1-hour kind of Zoom calls. And we had each one of them kind of completing a series of tasks, and they were asked to sort of talk aloud as they were doing that. So, okay, I'm supposed to go over here and click on this, and then that's going to open up this screen. They talk as they do it and mention things that don't make sense or things that they're confused about or can't find. And so the tasks were meant to be, standard ones that you would use on an app. So navigating it, finding a specific resource on the map, connecting to one of the training modules, and then they rated it on ease of use, educational value, and appearance. And in addition to that usability testing, we conducted a pilot study in an attempt to evaluate, is our training having the impact we want it to have? Does it seem to be making a difference in people's knowledge and at least perceived ability to identify and report? So originally, when we proposed for the funding, COVID-19 had not happened yet. And so we were actually partnering with a number of county health departments around the state of West Virginia. They provide quite a bit of day-to-day health care for folks who live too far away from larger clinics. And so we were working with them, and we were working with not just the healthcare providers, but we also plan to train the front desk staff, the custodial staff, anyone at all who might have any kind of contact with a patient coming into a clinic from the beginning to the end. And so we had to modify that because, of course, our health departments were just swamped with COVID. And so we had to scramble a little bit, and we were able to work with the School of Medicine at West Virginia University. And we thought, okay, well, it might be hard to get current healthcare providers, but can we get healthcare providers in training? And so we specifically focused on 3rd and 4th year students because they were the ones that had clinical expertise, clinical patients. They got some experience in this area, and they would go on rural rotations throughout the state. So we thought that that was a really good population to work with, and it actually worked well. So the ones who are participating, they took an online pre-test. So it looked at what they already knew around this topic, what kind of skills they had around identifying and reporting, and then how interested they would also be in getting such a training. And so everyone took the pre-test, and then everyone had access to the prototype modules for 10 days. And were asked to complete them at any point, during that time. And then they completed an online post-test to see if there had been changes in knowledge and their perceived skill. And so everyone did use the training. We compared their pre and post scores. And most of the measures specifically around knowledge and perceived ability did improve significantly. There was a ceiling effect for some of the items, specifically the risk factors. Maybe people already knew a lot about that, or maybe they were just kind of easy to guess from the questions that we asked. But regardless, on those items in the future, we want to give a little bit more thought to how we're assessing, maybe making some of them a little bit more challenging. And so based on our usability testing and our pilot testing, we learned that we need much shorter and much more narrowly focused modules. We were just trying to put too much information into each one because everything felt important. We found that we definitely needed some improvements in user interface and navigation to make things kind of clearer and smoother. And we also really want to spend some time to evaluate not just knowledge or perceived ability, but any kind of applied knowledge that we could. You know, it can be sort of difficult to use real world outcomes for this. You know, do we look at, you know, the number of times that someone reported a student for a potential trafficking concern? You know, do we look at the number of conversations maybe a teacher had with another school personnel because of concern for a student? You know, we sort of brainstorm all sorts of possibilities. We do know that we want to work more with the simulation center and standardized patients. I'll mention that again, just a second. So what's next for our project? Well, we finished the phase 1 funding, and just at the beginning of January, we submitted our application for our phase 2 funding. You know, we are fairly feeling good that we think we have a pretty good shot at getting that, so we're excited and hopeful. We do plan to keep the focus on healthcare and education, because if we get the phase 2 funding, it's a maximum 2-year project. So 2 full years to build the entire app and completely rigorously test it. So we felt we needed to focus on those 2 professions specifically. And we have already a larger advisory board of experts and consultants on a variety of topics: rural health, trafficking, training, and specifically incorporating trafficking into simulation learning. And although we had survivors involved throughout the process before, we really wanted them to kind of more actively shape the content as opposed to respond to the content that we generated. So they'll be more actively involved in that. And we've also contracted an e-learning content developer who works with Homeland Security and who actually designs their training for, you know, airport personnel to identify potential trafficking victims. And so we're excited about that. He's got a lot of knowledge and skills that we think are going to be great. We're working with a graphic designer with a lot of user interface expertise. Her name is Jill from Humanity Marketing. And then we're also working with the WVU School of Medicine and the Simulation Center, as I mentioned. We're going to be including simulation pre and post in our evaluation on phase 2. So a provider would go in to a learning situation and, you know, have a patient, ask them some questions, you know, respond to them, and then they won't have any idea, you know, what that patient has or is. Ooh, not sure what that crazy noise was. And then they'll take the training, and then afterward they would have another simulation with a different patient who has ostensibly been trafficked to try to see, you know, if their interaction and if the kinds of questions that they ask, if they're, you know, kind of trauma-informed questions, you know, if they've learned those things from our training. That's kind of a nutshell of sort of the whole process that we went through from beginning to end, and, you know, where we think we're going to go from here. Can I answer questions from anybody? Hopefully it means my presentation was so clear and comprehensive that you got everything out of it. Well, if you do want to talk more about, you know, what we did, seeking funding of your own, you know, anything like that, I would be really happy to discuss in the future if you'd like to contact me individually.
Dr. Ashcraft, thanks so much for the presentation. I was wondering what the biggest challenge was in the development that maybe surprised you or you weren't expecting.
I don't know that there were any challenges that surprised us. It was challenging from beginning to end, and we kind of knew that it would be. I think, to be perfectly honest, the challenge that I didn't expect came from, you know, being at home, working at home during the pandemic on this project, and being with my family, specifically my child, my husband, and kind of going back and forth between working on this very dark and emotional content and interacting with them, having to kind of keep it separate in an isolated space so that, they weren't hearing what was going on in the videos that I was editing. That was a challenge that I wasn't prepared for. We expected the technical difficulties, the challenges getting students to participate, all of those things we knew were coming. But the one that I didn't expect was sort of the personal challenges of interacting with the topic during a time of quarantine. Other questions?
And I guess kind of going off of that, of those challenges that you sort of anticipated and unanticipated, what lessons would you look for someone trying to develop something similar in the future?
That's a good question. I guess probably the biggest piece of advice is sort of being realistic about the scope that you're able to cover. We knew, for example, that to be able to cover like rural areas in terms of like Native American reservations, that really deserves its own training all of itself. And we knew that we just didn't have the expertise or the ability to do that topic justice. So that's one that we felt we weren't able to focus on. As I mentioned, we had to rein it in. We wanted more service personnel included initially, but really had to kind of focus on two. And we might have even been better to focus on one, in hindsight. So I think just kind of being realistic about what you can accomplish with the time and the funding that you have. You want to be all things to all people, but of course it's just not possible.
Absolutely. And we have another question in the chat. It's so what do you think is the most significant difference between rural and urban environments?
I think that probably the resources or the lack thereof is probably the biggest difference. I think trafficking is hard to detect in any environment. It's a hidden criminal thing. So those things are always harder to find. But given rural environments and how many more people have to be complicit for it to go on, more kind of everyday people, I think, are kind of involved in a kid's life. So I think you have to think about it a little bit differently. And then, as I mentioned, of course, with the resources, there's just not much that's specific. Even in West Virginia, it's hard to find substance abuse treatment for minors. So finding something, specifically helping trafficking victims and, connecting them to wraparound services is completely unheard of. So I think having to get creative, with what you can do. I guess those are kind of a couple of the bigger differences I see.
And then we also had a question about if you would be willing to share your slides with people who are interested.
Absolutely.
Okay. If you don't mind just emailing them to myself and Faye, and then we can email them out to people who attended.
Sure, no problem.
Amy, did you get any feedback from law enforcement, criminal justice on this app? And CPS, I'm sure once it's rolled out, there's going to be kids who are going to be identifying or self-identifying or seeking help. And, are the support services ready to receive the kids that are going to self-identify or be identified?
Well, that's a great question that I don't have the answer to. In terms of CPS and law enforcement, we did talk to folks from both of those areas during our interviews. We didn't necessarily seek feedback from them after the fact. We felt that law enforcement was the area where there was the most training that we saw. That seemed to be pretty well covered, even just in West Virginia alone. Like the law enforcement training, it's getting done pretty well. Not that there couldn't be improvements, but that's the biggest group that gets trained. It was really all the other professionals that we felt needed kind of more of the focus. So we didn't necessarily try to train law enforcement, although we did want to hear from them as we were developing it.
Thank you.
Mhm.
And so we had another question in the chat, did you see a difference in the overall results between the professions, such as medical professionals versus educators?
We did not test for any differences between professions. I think that, we didn't have the statistical power to look at that anyway. So even if there was a difference, we were unlikely to detect it. But certainly something to consider in terms of the larger outcome study for the phase 2 trial.
Thank you. Let's see. I don't see any more in the chat. If there's anyone else who has any questions, otherwise, I guess we can wrap up if that's okay with you, Dr. Ashcraft.
Yeah.
All right. So I just want to say thank you again for coming. I don't know, Faye, are you about to say something?
Yeah, thank you. Thank you so much, Amy. I can't wait till this is ready to be shared
Me too.
across the world. And do you have a timeline for that? You hope it'll be out there in 2 years?
Well, the earliest that funding could possibly start would be October of this year. And then that would be, 2 years of development and evaluation. So it's still a couple years out, and, it's a pretty time-consuming process, but yeah.
Yeah, awesome. Keep us updated. We'd love to have you back.
Will do.
See what's the phase that you're in, and it's an exciting project. And thank you for all that you're doing and your team. It's wonderful. Thank you, Amy.
Thanks, Faye. Thanks for having me.
Oh, thank you.
So thank you so much for being here and speaking with us, and thank you for everyone who's here in the session with us today. It was wonderful hearing from you, Dr. Ashcraft.
Yeah, thanks to the folks that came.
Absolutely. And I'm just going to hand it over to Ben real quick, just to go through a feedback survey we're doing and kind of logistics for the rest of for later sessions.
All right, I'll turn over the share screen.
If you were here from the earlier session, you're familiar with this, but this is our feedback form. So it was originally designed to get feedback after the last session of the symposium, but we also really appreciate hearing your thoughts on this session as well. So you can either follow the link that I put in the chat to the survey, or you can scan this QR code with your phone. Another logistics thing is that to get to the next session today, there's a separate Zoom link. So you can either check your email and find the link that Faye Chelmo sent, or I can also put the link to the next Zoom link in the chat for this session, and you can copy and paste it out of there. Thank you.
All right. Thank you, Ben. So yeah, we if you fill that as you finish your sessions, and hopefully you can join us for other sessions for the symposium. But otherwise, thank you again for everyone who came out. Our next session begins at 1:30, so we'll leave the screen up until then, and until the next Zoom link opens up as well. So appreciate everyone who's come out, and hope to see you again soon. And yes, there's a question about all the other sessions for the symposium. So that link is in the chat as well. And hopefully we can see you all there. Thanks.